Hi guys, my name's Mary Beth.
I'm Amelia.
I'm Jessica.
I'm Leah.
And I'm Erica Filming.
And we are the Healthy Beginnings group. Our motto is be happy, be healthy. And this semester we've been studying the Healthy Start Coalition of Osceola County. So this is the board with some of the details on it. And first we're going to show you a skit to kind of give you an overview of how the organization works. And then after that we'll each give you a little bit more detail. So hope you enjoy the video.
Hey Jessica, I'm sorry to cancel plans again, and I know we were supposed to go out, but I can't tonight.
What, again? Are you serious? You're being so lame.
Jessica, I really wish I could explain, but I really just can't go out.
Something must be wrong. Will you please tell me?
Okay, fine. I'll be over in 10 minutes.
I'm so glad you came over. Is everything okay?
No, it's actually not. It's really bad. I slept with someone a few weeks ago, and now I'm pregnant.
That's horrible. You're so young. What are you going to do?
I know, and it gets worse. I barely have any money. I don't know how I'm going to be able to afford this.
Well, let's just go to the doctor and see what they have to say.
Okay, good idea.
Hi, welcome to the Osceola Health Department Center. How can I help you?
Hi, my name's Amelia Brainhoff, and I just found out I was pregnant, and I really don't have any money, and I'm really not sure what to do.
Oh, don't worry. We're going to get you checked into the doctor, and we'll just figure things out from there. So if you can fill out this paperwork for me, Amelia, then the doctor will call you right on back.
Sure, that'd be
You
great.
can take a seat in our waiting room. That'd be great. Sure. Thank you.
Is Amelia here?
Oh yeah, that's me.
Oh, you want to come this way?
Sure.
So I'm going to be examining you today. Can you tell me what happened? Did you just find out you're pregnant, or?
Yeah, I actually just found out today that I was pregnant. I had unprotected sex with this guy a couple weeks ago, and I started getting sick out of nowhere. Just kept throwing up for weeks, and my friends were like, you need to take a pregnancy test, and I thought they were crazy, but because the sickness didn't stop, I took a pregnancy test today, and it said I was pregnant.
Well, it seems to me that you're probably within the first 6 weeks of being pregnant, which is good because it's so early. Have you decided if you're going to keep the baby or not?
Yeah, I mean, I really haven't had much time to decide if I'm going to keep it or not, but after visiting the doctors today, I think the best choice would be for me to keep the baby.
Okay, well, you qualify for a screening, so why don't we go ahead and get you started?
All right, sounds great.
Well, based on the results from the screening, we recommend that you start on the Healthy Start program. And here to talk to you more about that is our nurse, Leah. So she's going to go ahead and get you
Hi,
started.
nice to meet you too.
You come over here, we'll get you registered.
All right, sure.
Okay, basically what Healthy Start is we promote the health and well-being of children and the community from when you're pregnant to after the baby is born. And we start working with you from the start to then. We provide a couple resources once you have it registered. What's your name?
It's Amelia, Emmelia, Bradenhoff, Bradenhoff.
Okay, great. Well, the resources we can provide for you that you are available for are the WIC office, and there's a Medicaid office that actually works with you to provide you insurance. And we also, if you have no transportation to get to and from your doctor's office, we also work with the Links Transportation that can get you to and from the doctor's office if you have no other way.
Wow, that's actually really great because I don't have a car right now, so.
No problem. Do you know how far along you are?
Yeah, after speaking with the doctor, we found I'm about 6 weeks along.
6 weeks, that's great. You're not too far along. Okay, well, we have you registered, and you'll be contacted by one of another program specialists in a few days. Thanks.
All right, thank you so much. Hey Jess, how are you?
Good. How's the pregnancy going?
It's going pretty good actually. Just swollen ankles, I've been throwing up sometimes, but the Healthy Start program that I was referred to, they've really been helping me out and they've really been great, and I'm really thankful that we went to the doctors and they referred me to them.
How far along are you?
Well, now about 6 months, and we actually picked out a name, Joey, so.
Little baby Joey.
Yeah, I know, but yeah, thank God for your help and Healthy Start. They really helped me with this pregnancy.
It's good. Well, I'm glad it's going good.
Thanks, me too. And now I'll be describing the description part of our board. The Healthy Start Coalition of Osceola County is a nonprofit organization that strives to decrease the infant mortality rate. Now, the idea behind this all started in 1991 when the Healthy Start program was passed into legislation by Governor Lawton Chiles, who noticed that Florida had one of the highest infant mortality rates, and he wanted to do something to lower them. Now, the Healthy Start Coalition offers many services at little to no cost for new mothers and their newborns. Services such as screenings, education on childbirth, parenting education, nutritional counseling, as well as psychological counseling. The Healthy Start Coalition is located in St. Cloud, Florida, and provides services to all mothers and their infants living in Osceola County. The coalition has been successful in lowering the infant mortality rates because the rate was originally 10.6, and within the last couple years, they have managed to lower that to 5.9 deaths per every 1,000 childbirths. Now, along with reducing infant mortality rates, the coalition has helped many mothers and newborns throughout the birthing process, as well as bringing together different individuals such as leaders, businesses, and churches together who all have the same collective goal of reducing the infant mortality rate.
And now I will be explaining the interaction system. The goal of the Healthy Start Coalition of Osceola County is to promote the health and well-being of women and children in that area. As they seek to fulfill their goal, the members of the HSCOC become interdependent on one another, and the two types of interaction that take place is task and relationship interaction. Task interaction is defined as all group behavior that is focused principally on the group's work, projects, plans, and goals. Relationship interaction is defined as the actions of the groups that relate to the influence, the nature, and strength of the emotional and interpersonal bonds. Carrie Linville, the HSCOC program specialist, is a prime example of the task interaction in the organization. She spends most of her time filling out medical forms, writing reports, and observing committee meetings. Her relationship interaction in the program involves training and educating the nurses and medical assistants. The nurse and the medical staff have more of a relational interaction because they spend much of their time with at-risk mothers and newborns. For example, Gwen Winkfield, the nurse supervisor of HSCOC, provides day-to-day counseling provided by the HSCOC. And that's where she builds her relationship with the mothers. As you can see, they incorporate task and relationship interactions variously through their organization, and because of these actions, they have been able to build resources such as the WIC office, Medicaid office, and housing divisions to help support their mothers and their children.
Now for a little bit about the structure of the organization. Just like any group, the Healthy Start Coalition has certain norms and rules that help the group meet its goals. So what are norms? Norms are basically standards. Standards that describe what behaviors should and should not be performed in a given context. So what about norms in the Healthy Start Coalition? Well, according to Healthy Start's program specialist, Carrie Linville, communication is the most important norm, the most important standard in the organization. Carrie Ann explained that it's important to communicate when you're going to be in the office, when you're going to be out of the office, when you're going to be in a meeting, when you will be answering the phone, when you need someone else to answer the phone, and so forth. It's polite, it's courteous, and it helps keep the organization running smoothly. While communication is the most important general norm, the Healthy Start Coalition has other, more specific types of norms. For example, proscriptive norms can be described as types of actions that should be avoided. In the Healthy Start Coalition, proscriptive norms include showing up to work in your pajamas, coming into the office flaring, and just being sloppy. These are types of actions that should be avoided. They're proscriptive norms. Another type of norms are injunctive norms. Injunctive norms are kind of like rules. They describe what types of behaviors people have to do or they get in trouble. Injunctive norms in the Healthy Start Coalition include being on time to work and being on time in submitting your reports. If employees do not perform these behaviors, they can get in trouble. So in addition to norms, the Healthy Start Coalition has very specific roles within its organization. A role is defined as a socially shared set of behaviors, characteristics, and responsibilities expected of people who occupy a particular position or type of position within the group. In Healthy Start, there are various positions that require very specific roles. Positions with distinct roles include the board of directors, the executive director, the program specialist, the bookkeeper, the mom care specialist, the nurses, the doctors, the clients, and patients, and so forth. Looking a little bit closer at some of these roles, you have the board of directors who identifies resources and creates a vision for the organization. You have the executive director who oversees the everyday details of the Healthy Start program. And you have the program specialist who files the reports that get sent up to Tallahassee. In addition to specific norms and roles, Erica is going to tell you a little bit about the organization's goals.
And now for the goals. The mission of the Healthy Start Coalition of Osceola County is to promote the health and well-being of mothers, babies, and families in our community. Their goal is to improve pregnancy, health, and developmental outcomes for residents of St. Cloud and all of the Osceola County. They work to reduce infant mortality and morbidity, low birth weight and preterm births, and increase access to care to give all children the best potential for a healthy and productive life. Healthy Start seeks to minimize economic, social, and geographic barriers to maternal and child health. It seeks to provide accessibility to healthcare programs. It seeks to create an association between the private and public sector, creating community-based alliances for maternal and child health. It seeks to evaluate the community's need for the maternal and child health. Furthermore, it seeks to create plans to promote maternal and child health without duplicating existing services.
Now for the decision-making process. Like any group, the Healthy Start Coalition of Osceola has a decision-making process to help reach their goals most efficiently. All decisions are followed by a certain system for the organization. Major decisions are made by the board of directors. Following the board of directors comes the organization's executive director, who makes decisions and provides leadership for the group. If a decision needs to be made and the executive director is not present, the bookkeeper takes the place as the final decision maker. The program specialist, mom care nurse, and bookkeeper follow the head directors. While this reflects the main decision-making process, the Healthy Start Coalition has another decision-making process for evaluating community needs and enrolling women into the program. First, the Healthy Start Coalition conducts an area-wide needs assessment and then develops local service delivery plans that contain the community assessment along with a data review, health analysis, and a step-by-step action plan. Once the delivery plan is in place, the Healthy Start Coalition works to coordinate health care provider services to pregnant women. In order to know who to provide services for, the healthcare providers screen at-risk mothers and newborns using a Healthy Start screening. After the screening, doctors and nurses make the final decision on which women qualify for the program, but the women always have to choose to accept. In this way, doctors and nurses and the women each participate in the decision-making process. If not invited, the women can always choose to apply to the organization as well.
Now for the research and study part. 2 ways to study the Healthy Start Coalition of Osceola County that work well together are the SIMILOG method, which stands for a system for the multiple level observation of groups, and the Beckham method, which stands for beginning, engaging, contextualizing, and managing. SIMILOG is a quantitative internal assessment of group function made by members of the group, whereas Beckham is a qualitative external assessment made by an outsider observing the group. And outside of these methods, at the most basic level, ways to study and research the Healthy Start Coalition is to include overt observation, which is openly watching and recording information with no attempt to conceal one's research purpose, and self-report measures, which are such as personal interviews with the group's members.
All right, well, thanks for watching our video. I hope that you enjoyed our skit, and I hope you enjoyed learning a little bit about the Healthy Start Coalition of Osceola County. But if you would like to have more information on the group, or if you are pregnant or know someone who's pregnant who could benefit from the program, I encourage you to contact the Healthy Start Coalition for yourself. They can be reached at 407-343-2100, or you can visit their website at www.healthystartosceola.org. Thanks for watching our video.